It's been exactly a month now since Multnomah County's Drug Deflection Center opened, and it's been a slow start. Just 13 people started the deflection process over the course of the first 2 weeks the center was open. The Coordinated Care Pathway Center is up and running just off Southeast Sandy. When people are caught by police using drugs in public and they aren't committing any other crimes and they don't have any outstanding warrants, police can drop them off at the deflection center where they can be evaluated for things like drug treatment services, housing, or mental health services instead of going to jail. At least that is the goal. Today, Multnomah County gave an update into how things are going. They say they're working to connect people with services, but that those services don't always exist. Portland police say that since hard drugs were recriminalized September 1st, they had roughly 225 interactions with people using them, and 97 people chose to go into deflection. County data shows 91 of them decided to go forward with that process. Police didn't have a place to send people until October 14th when the center opened. So they did mobile deflection, where they met with people on the street and tried to refer them to services. For the deflection center itself, Multnomah County only has data for the first 2 weeks it was open, between October 14th and October 31st. They say in those 2 weeks, there were 19 referrals from law enforcement, and 13 of those started the deflection process. But the county says those 13 people received 32 total referrals for housing, treatment, and other help. Different services can count as different referrals, if you're wondering. Whether or not those 13 people will successfully complete the deflection process remains to be seen. They have 30 days to follow up on their referrals and check back in with the deflection center. While service providers say they've seen some positive cases so far, they say there's still a long way to go to actually provide the level of help some people need. Tony Vesna runs 4D Recovery, one of the treatment providers connected with the deflection center.
One of the big problems is, and everybody's aware of this by now, is that there's a lack of overall resources in the continuum of care. And so, we have a deficient ecology of services for people. So people can't always get the services they need when they want it. And that can be a big barrier to care. But, through House Bill 4002 and, our elected leaders, including our governor, more resources have come online. And I believe more resources are on the way.
In order to successfully complete the deflection process, a person has to follow up on one of their referrals. The county says they could be referred to drug treatment services like sobering and detox, withdrawal management, outpatient treatment, peer services, or housing navigation. But even if they do not go through drug treatment, but follow up, let's say, on a housing referral, that would still be considered completing deflection per the county's standards. The county says they plan to release bi-weekly deflection updates along with quarterly and yearly reports.